Hi guys, my name is Sanjay Gupta. I'm a consultant cardiologist, and today I wanted to talk to you about a common fear that a lot of people have when they suffer from ectopic heartbeats, and that is a lot of people say to me, does that mean that I would go into atrial fibrillation? And for a lot of people, the prospect that their ectopic beats could result in them developing atrial fibrillation is a real concern. And I thought I'd try and address this because I think for a large number of people, that fear is unfounded. The first thing to understand is when you're thinking about atrial fibrillation, there are two types of atrial fibrillation. The first is people who have inherited a genetic tendency towards atrial fibrillation, or people who are just very unlucky. And those people are a minority, okay? So the majority of people who have atrial fibrillation because the heart has been put under stress from something else. And usually that is because of high blood pressure, diabetes, sleep apnea, and all these things put more stress on the heart. So when you think of it, the easy way to try and think of this is that if you think of the heart pumps blood into arteries, and then from the arteries it goes into small capillaries, and then it goes into veins, and then it comes back to the heart. So if you want to think of it, you can think of it like a pipe, okay? A muscular pipe all the way around. So it's a completely closed circuit pipe, all right? Now, what tends to happen is, because of bad lifestyle, aging, diabetes, high blood pressure, there are areas of the pipe that start getting narrowed. And therefore the heart is having to pump against these narrowings, and therefore the heart is put under pressure. Now, if you had the way to tell that the heart is being put under pressure is because the left atrium is a thin-walled structure, whereas the rest of the heart, the arteries are all very muscular. But the left atrium is very interesting because it's a thin-walled structure, and therefore any pressure on the heart causes the left atrium to start dilating because it's having to work harder, and because it's thin, it starts dilating. It's almost like having a balloon attached to this tubing, this pipe that I said, so you can liken the heart and the arteries and veins basically like a pipe, closed pipe. But if you take a little bit out and put a balloon there, attach that to the pipe, if there is a constriction somewhere in the pipe, then the balloon will get bigger because that's its response to more, the pressure will cause it to get bigger. And the left atrium is like that. So for the majority of people, what tends to happen is because of high blood pressure, because of diabetes, because of sleep apnea, because of excessive weight, the left atrium is put under pressure because the pressure in the whole circuit goes up. The left atrium starts dilating. And as the left atrium dilates, it becomes irritable, and people can get more and more atrial ectopics. And eventually, as time progresses, those people develop atrial fibrillation. However, if you don't have any of those things, and your left atrium is completely normal, then it is highly, highly unlikely, unless you're very unlucky or have some kind of genetic thing, that you would go into atrial fibrillation. So if your question is, oh, could my ectopics result in me going into atrial fibrillation? The answer is have an echocardiogram and get someone to measure your left atrium. Some people say, oh, well, it looks big on the ECG. I wouldn't rely on the ECG. Have an echocardiogram, have your left atrium measured by volume. And if your left atrium is of a normal size, it's very unlikely that your ectopics will develop into atrial fibrillation. It is very, very difficult to fibrillate a normal sized left atrium, okay? Now, if on the other hand, you find that your left atrium is enlarged, then don't panic. It's not necessary you'll go into atrial fibrillation, but it tells you that maybe the pressure in the circuit is going up for some reason, and you may then have to look at your lifestyle, say, is there anything that I could do to reduce the pressure? Common things are good nutrition, okay? reducing your weight and getting regular exercise, getting good sleep. If you have diabetes, controlling the diabetes. If you have high blood pressure, controlling the blood pressure aggressively. And all those things will then stop the left atrium from getting bigger. And hopefully it will stabilize things. So for the majority of people I speak to, they get ectopics. We all get ectopics. Those ectopics don't signify anything particularly dangerous. When people come to me and they say, look, will my ectopics develop into atrial fibrillation? I say, let's do a scan of your heart. Let's look at your left atrium, because the left atrium is a window into this circuit, and it tells you whether everything in this circuit is running smoothly. If the left atrium is normal size, then it is highly unlikely that your ectopics will develop into atrial fibrillation. All right. If you've got bad lungs, if you've got bad high blood pressure, if you're very overweight, if you're diabetic, then it's not uncommon for us to see a dilated left atrium. And in that setting, that should be a warning just to say, okay, maybe I need to modify my lifestyle, okay? And I need to be aggressive about this, because if I continue doing that, then the left atrium will get bigger and bigger. It will become more irritable. You will get more ectopics. And eventually, if nothing is done, it'll develop into atrial fibrillation. Again, even if it does develop into atrial fibrillation, atrial fibrillation, apart from an increased risk of stroke, is not a dangerous thing. It doesn't, cause people to drop down dead or anything like that. So I just want to alleviate people's anxiety about this risk of atrial fibrillation. The risk of atrial fibrillation is placed upon a person because of their other comorbidities like high blood pressure, diabetes, etc., and not necessarily just because of the ectopics. So I hope this was useful. I am so grateful, so grateful for all the kind words. It is overwhelming. What do I say? You guys are amazing for what you say. It's so generous and so kind. It's overwhelming. It fills me with enthusiasm. It wants me to do more. I'm just so grateful. Thank you so much. This is me. Right, Dr. Sanjay Gupta, my website, yourcardiology.co.uk, and I have a Facebook page. So if you want to ask me any questions, come along, join me on Facebook, and I'll try and answer questions. So people who've been waiting, I'm really sorry, it's just been hectic, but I will try and get around to answering all your queries. All right, thank you so much. All right, all the best. Take care. Bye.